I'm Dr. Kelvin Lee, consultant psychiatrist in Island Hospital. Okay, today I'll be talking on a topic, an interesting topic on how the unconscious mind and my past memories affect my mood. Okay, so before I start, um, I would like to just share a little bit about myself. That I'm a consultant psychiatrist with more than 15 years of experience in the field of psychiatry, and I have been with Island Hospital for the past 8 years. So, besides prescribing medications, like all psychiatrists do, I believe in the combination of medications with psychotherapy to treat and manage people with mental health issues. I am very interested in psychotherapy, and I've had intensive training, and I'm certified in practicing EMDR, clinical hypnotherapy, cognitive behavioral therapy, and sampling therapy. So, um, there are actually 10 interesting questions to ponder about this current topic that I have. And most of these questions are an accumulation of a combination of the questions that usually my patients ask me. And I have sort of combined it all as to I have sort of okay, I have sort of combined it all uh, to that is according to this topic, that is questions that are related to this topic. All right, so like I will be going through, like, when do I know when to seek for help for depression or anxiety. Can I seek just spiritual help only to treat my depression or anxiety? Why, after taking medications, I still can't get well from my depression or anxiety? Why, even after I try to think positive, I still can't overcome my depression? How to differentiate conscious mind and unconscious mind. And I'll also be talking a bit about the subconscious, because a lot of people get confused about the subconscious or unconscious. So I'll talk about conscious, subconscious, and unconscious. All right. And how can past memories lead to depression or anxiety? What can we do with the past memories? When to consider medications? When to consider psychotherapy? Can I just do psychotherapy without medications? And if I'm depressed, does it mean that I'm mentally weak? Okay, so for the first question that normally my patients ask, and they usually this question they ask for their friends or their relatives whom they thinking of referring. Like, when do I know when to seek for help for depression or anxiety? Like, for them, it's like, when is the signal? When is the sign that, oh, this is the time that you need to see someone for help? All right. So first and foremost, I would like to just go to the to basics. Like, feeling anxious and feeling sad can be considered a normal emotion. All of us feel anxious at times. All of us feel sad at times. If we never feel anxious or sad, it's either we are a robot or we are dead. Okay, so this is just how our brain react to stress. So if we are feeling anxious, it could mean that our brain is alerting us to some potential danger or potential stress or distress. For example, if you're sitting for an exam, oh yeah, so this is something anxious, something that a stressor that makes us anxious. When you're facing a target deadline at work, when you worry about your finances, or you worry about your health, or some people worry about their spouse's infidelity, uh, or you may be anxious about social situations, like when you go to the party, or when you go to school. um, so the usual thought that you have is like, oh, will they approve of me? Will I be approved? Will I be boycotted? Can I join in the group? You know, what would they think of me? So these kind of things also can make you feel anxious. But sometimes it can still be normal. But the rule of thumb, when there is impairment in the social occupational function, uh, for example, if you start to avoid your friends, and there's a social withdrawal, or you have a lot of arguments, or you don't talk at all with your family, you know, or you you avoid going to work, or you avoid going to school, this is actually an impairment already. So this is can be considered quite serious, and then you should be seeking for help. But however, at times later on in the later slides, I will explain to you that you do not really need to wait for the bridge to break down or collapse, like an impairment. The social occupation impairment is like a bridge that's already collapsed. You do not need to wait for the bridge to break down and collapse, then you need to seek for help. Sometimes there are just a few cracks here and there. You may need to touch up the cement here, cement there, and the bridge can still stay healthy and okay. So uh, sometimes we may need to seek help even before the impairment comes. So that's why we need to highlight, certain stressors actually can trigger our negative core beliefs. So each of us have some certain negative core beliefs, and certain stressors, when we face it again, it can trigger our negative core beliefs. So I will explain later in the later slides when we have the diagrams and the pictures, so that it's easier for you to understand. Okay. So first we have to understand what is depression and what is anxiety. Okay. So a lot of my patients, they sometimes get confused. What is the depressive symptoms? What are depressive symptoms? What are anxiety symptoms? And some of them even ask me, because okay, in Mandarin, depression is 忧郁症, and in anxiety, it's called 焦虑症. So 忧郁 and 焦虑. So some of my patients ask me, is 焦虑 actually depression? Is 焦虑 depression? Some of my patients are confused that 焦虑 is depression, so they think anxiety is actually depression. But anxiety is not depression, and depression is not anxiety. But they may be combined, so that's why sometimes it's a bit confusing. So what are depressive symptoms? Depressive symptoms like you look at this picture, it's blue, and this patient looks down. So there is a depressed mood, there's a loss of interest, and then there is a change in the sleeping pattern and the appetite and the weight. That means in the sleep, it may be increased or it may be reduced or increased. Appetite can be lost or increased. Weight can be lost or gained. So not necessarily, oh, I can't sleep, only I am depressed. Some people, when they sleep too much, eat too much, it also can be a sign of depression. Okay, so as we go, as slow down or restless, in the psychiatric term, we call it a psychomotor retardation or agitation. So to make it simple for people to understand, I'll just say slow down or restless. So slow down, your thoughts or your movement become more slow down. So you feel lethargic, fatigue, loss of energy, you feel unable to do anything, you feel lazy. So sometimes people tend to get confused that, oh, this person is lazy, but maybe this person actually is not lazy, maybe he's depressed. Okay. So coupled with that, there may be feelings of worthlessness, guilt, hopelessness, and even thoughts of dying. So these are depressive symptoms. Okay. And now what is anxiety symptoms? So you look at the cartoon there. So the cartoon, the cartoon is like this guy is all over the place. When you see compared with the depression is actually down. So when anxiety symptoms are like there are a few overlapping symptoms like impaired concentration. So in depression also have impaired concentration. There's insomnia, difficulty sleeping, irritability. Irritability is you also can get in depression. Sometimes there is an agitated depression, so you also may have irritability. Restlessness, that also can be found in one type of depression that has the psychomotor agitation, that is the restlessness. However, in the anxiety, you have tense muscles, trembling or shaking, cold, sweaty, numb, tingling hands, dizziness, dry mouth, heart palpitations, and difficulty breathing. And GI symptoms is gastrointestinal symptoms. It's like nausea, you feel like want to vomit, or abdominal bloating, feel like a lot of us say or a lot of hong and then I feel like all these kind of things. So this is like the GI symptoms. And rumination is like when you think a lot about a certain problem or a certain stress. You think over and over and over again, and it cannot stop. So when you ruminate, sometimes it can lead to panic and fear, and then it may even lead to feelings of impending doom or danger. Impending means that, oh, the doom may be coming or the danger may be coming. So there's an anticipatory anxiety there. So when you feel like, uh, I'm going to die soon, or there's going to be danger coming, so it may result in avoidance. You may avoid the situation altogether. If there is a place that you are afraid of, maybe some people are afraid of marketplace, in crowds, or close enclosed places, you may avoid that place totally. You may avoid a certain object, you may avoid a certain people. Maybe your teacher has scolded you, humiliated you in class before, and you want to avoid, so you don't go to school. So that's the so that's the avoidance behavior. It may lead to avoidance behavior. Okay, so this is anxiety. All right. So for our next question, can I just seek spiritual help only to treat my depression or anxiety? Okay, before I go to that, I would like to explain that when we treat patients, we go through a model. It's called a biopsychosocial and even spiritual model. So it's a BPSS model, biopsychosocial and spiritual model. So all these actually contribute to the welfare of our mental health. So for biological, if you have a genetic loading or genetic vulnerability for depression or anxiety, some people maybe they are born with less serotonin in the brain, so they have more tendency, or they're more inclined to become depressed or anxious. Some people have a family history. Maybe they have families who have certain depressive or anxiety disorders, and sometimes it may run in families. Not everybody will get it, but sometimes it may. Okay. um, medications, certain medications like anti-epileptics, antihypertensives also can cause biologic depression, and even substance abuse also can, when you take substance like ecstasy, methamphetamine, amphetamine, these kind of drugs, it may get you high, but we don't take it. It's like there's this withdrawal symptoms, and you get a depressive phase. When you don't take it, then you go very low. Okay, so this is actually biological, a biological. Another thing is medical illnesses. All right, medical illnesses also is a biologic. It could be a biological cause factor. So like medical illnesses like hypothyroidism, like when there's a lack of thyroid hormones, also can cause depressive illness. Okay, and if the hyperthyroidism can cause more anxiety. Okay, so let's go to the psychological factors. Psychological factors, we have personality traits. So every one of us have a certain kind of personality. Maybe some people are more paranoid. Maybe some people are more compulsive. Maybe some people are more dramatic. So we have a certain kind of personality. So and then our self-esteem also can affect us. Our coping skills, how we cope with our problems, and also our past memories and the unconscious mind. For social, we all of us also need social support. No man's an island, so it's like family and friends are our social. And spiritual. All right. So for spiritual, of course, there are those who believe in God and those who don't believe in God. But I think in Malaysia, most of us, I think probably most of us believe in God. Uh, but anyway, I got quite a number of patients. Like they tend to ask, can I just pray? Can I just pray and make it all go away? Okay, that is actually possible. That of course I do believe in miracles. Miracles do happen, but maybe it doesn't occur so often. So, but I would like you to tell a story, an analogy of God giving help through uh, other means that is actually a prayer, an answer to your prayer. Like this picture here. Okay, this story is, I think most of you have heard about this, but I'll just repeat it anyway. A man, he fell off his boat, and then he's drowning. All right, and then the first boat came, and then he said, "No, no, 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 no need, no need, no need. I don't need help. God will help me." So, so he's waiting for God. Then the ship passed. The first ship passed by. Second ship came again. Sir, you need help or not? Oh, no, never mind. I wait for God to come help me. God will take me up, you know. So, second boat passed by. And the third boat came again. Sir, do you need help? I want to take you up give you a life buoy. Come, I want to catch you up. And he said, no, never mind. I'll wait for God to come and help me. Maybe he's expecting God to deliver him up with chariots of fire, like a whirlwind up to heaven. Okay. So, but then in the end, the third ship left. And then finally he drowned. And when he drowned, and when he went to the other world, and he met God, and then he asked God, God, why didn't you save me? And God answered to him, I gave you so many types of help. I gave you 3 ships to come and help you, but you didn't accept my help. You know, you didn't accept my help. So sometimes in this world, God can help us in biological, like medication, psychological, psychotherapy, social with our friends and all that. It can help us in so many ways. We need all these. Definitely, we need all these. To get well. You know, so in this world, we need something tangible, and God knows that. God provides that. So we can't say that, oh, just because it's medication, it's not God. So sometimes we just try to keep an open mind that God can also help us in so many different ways in this world, because the usually God gives us something tangible to help us. Like, tangible means something you can touch, or something you can experience. Not necessarily it has to be a spiritual experience to be totally cured, but we can get cured from biopsychosocial and also spiritual. Whichever areas is okay, is good enough. All right. And now let's go to the next question. Okay. So for biological, yeah, just now I explained that biological. Can I just seek spiritual? Sorry, this is that. Well, next question is, why even after I try to think positive, I still can't overcome my depression? Okay, so for the psychological, um, uh, for the psychological, um, sometimes when we try to think positive, a lot of people think that, I'm going through a lot of stress. Just think positive, and you'll be okay. But sometimes there may be certain things that drag you down, like certain past memories and your unconscious mind, which you are not aware of, and uh, it's not something that is deliberate, that you can just outthink your depression. These things can still be certain triggers that can still get you depressed or anxious. These things I will explain later in the later slides. Okay. So, conscious mind uh, versus unconscious mind. So, what is the conscious mind? What is the unconscious mind? Okay. So, let's picture this iceberg. Okay. The iceberg is like, if you see above the surface, it's just maybe 10% is the conscious mind, and 90% is the unconscious mind. So what we are conscious of is usually only 10%, but what we are unconscious of is 10%. And there's also sometimes my patients are not very clear or confused. What is they think that unconscious is actually subconscious, but there is a slight difference there. Okay, let me explain. Okay, let's imagine the subconscious is just below the surface, but the unconscious is much deeper down there. Okay, so for subconscious mind, it is actually your mind, or your mental process, that is currently not in the focal awareness, but it can be recalled when triggered, and it doesn't need psychotherapy to do that. Whereas unconscious mind is usually unconscious. So that is you need psychotherapy to dig it up, because it doesn't come up so easily. So for example, like the unconscious mind, if you're not in the focal awareness, for example, now I'm my focal awareness is giving this talk, and going through the slides, and giving this talk. This is my focal awareness. All right. So let's say somebody passes by me, maybe somebody in a pink dress, and maybe I know that person shape. So maybe that person is Miss Tan, for example, and then she passed by me, okay, on the side. Then but and I didn't realize she passed by me, but I'm just so focused here. And later, when somebody asked me, do you realize that somebody passed by you when you were giving this talk? Oh yeah, I think Miss Tan passed by me. She was wearing a pink dress because it was at the corner of my eye. But then when they asked me, you give me a cue trigger, then I can recall. Then I can recall it. So subconscious mind is actually not in your current focal awareness, but you can be brought, it can be recalled, but it's not totally unconscious. So it's just below the surface. So that is actually coined by Pierre Janet lah. But the unconscious mind is actually coined by Frederick Schelling and made famous by our very famous Sigmund Freud, uh, uh, because of his psychoanalysis theories in the early 20th century. Okay, so unconscious mind is what is beneath. So normally is unconscious, and normally it tends you need psychotherapy to to make it surface. Okay, let's go through what is conscious mind and unconscious mind. So the difference between conscious mind and unconscious mind is the conscious mind is intentional. I intend to do this, so now but unconscious mind is spontaneous. Conscious mind is logical and sequential. You go by sequence. Whereas unconscious mind is simultaneous and it works by association. Conscious mind is verbal, while the unconscious mind is non-verbal. Conscious mind is analytical, it asks why, whereas the unconscious mind is intuitive. It processes the feelings and knows why. Conscious mind is deliberate, unconscious mind is automatic. Conscious mind is limited, but the unconscious mind is unlimited, like the bottom of the ocean. Conscious mind is cognitive learning. That means that you are consciously learning something. Whereas the unconscious mind is like experiential learning. That means you learn from your experience. For example, how many of you know how to ride a bicycle or swim? I mean, when you learn it in the past, you don't forget how you can ride a bicycle or swim. You definitely know how to balance a bit. And you swim also, you know a little bit, but maybe you'll be a bit rusty. Maybe you haven't swam for 10 or 20 years, but you can still swim. You can still float. And when you ride a bicycle, you can still balance. Doesn't So this is what we call experiential learning. The experiential learning normally you don't forget. You learn before, but you don't forget anymore. It's experiential. So conscious mind calculates what is right. Unconscious mind feels right. Feels right, not right, feels right. So a lot of women are like this, they feel what is right. So and that's what we call female intuition, right? They feel what I feel what, but then normally what they feel is also right lah. So this is what we call, sometimes we call it the gut feeling. And conscious mind is cognitive driven, whereas the unconscious mind is, there's a lot of defense mechanisms inside the unconscious mind. Okay, what are defense mechanisms? It is actually the unconscious mechanism that you are not aware of, but uh, it actually, the main function is to help you reduce the anxiety that comes from harmful stimuli. Means, for example, if something, a stressor or a trigger makes you, I'm going to feel anxious from it, or I'm going to feel depressed from it, or what. So your unconscious mechanism try to reduce it by certain ways. For example, I don't know whether you have heard of the Aesop's fables, the sour grapes. Okay, there's this fox. He want to jump, want to get the grapes, the sweet grapes on a very tall tree. So he jump, and he cannot catch it. Then he say, yeah, the grape is sour lah. It's not sweet. So the sour grape, I don't like it anyway lah. It's just sour. I don't want it. So this is what we call rationalization. So it rationalized that, never mind lah, this and not good anyway lah. Just for example, if in your situation now, let's say if a boy wants to tackle a girl, and then the girl very pretty or that, then but then when he gets rejected, I said never mind lah. she's no good anywhere. The character no good. Like even though she's very pretty. Okay, okay. Then makes him feel better. So actually, it's an unconscious process to help him reduce his distress over the rejection. Another very important defense mechanism is dissociation. Okay, dissociation is actually an unconscious mental process that disconnects our mind disconnects us, from our thoughts, feelings, memories, and even sometimes our sense of identity. Okay, so for example, the mildest form of dissociation is actually like daydreaming. Anybody here never daydream before? I think most of us got daydream before lah. So of course, all of us also got dissociate before. So sometimes when we daydream, and we are very stressed at work, or we are driving, then we daydream. Oh, how nice it would it be to be somewhere else, or to go to the beach and relax there, or something like that. There's daydreaming actually is a dissociation. Okay, so when it becomes uh, more severe, then the dissociation can even develop into depersonalization, derealization, where you feel like you're not yourself, and you feel like this place is unreal. And even more severe form is a dissociative amnesia, which is actually called repression in defense mechanism. So this repression is a is a unconsciously forgotten memory. So it's called a dissociative amnesia. So what kind of thing can dissociate? What kind of memory can make you want to dissociate from it? For example, uh, a person who has been raped before, a girl who has been raped before, or some sexual abuse, or maybe physical abuse, they may they may feel that this thing never happened to them. You know, it's totally blocked off already. There's a dissociative amnesia from it. So they don't remember it at all. You know, and the most severe form I would say is the dissociation of the sense of self, sense of identity. Sorry, which is actually DID lah, dissociative identity disorder. So in DID, dissociative identity disorder, in Mandarin we call it 人格分裂症 lah. So um, identity is even more different. So for example, a person who gets bullied by his peers, then he gets bullied, then because he feels weak, so he create an identity inside that is stronger and more protective to come out and protect him, and then he becomes someone else, totally different person, totally different personality. But that totally different personality may be even over aggressive, may even beat up the peers, may even beat up other people. So it can get until like that. So a lot of people sometimes they are not very sure, or they are confused. This 人格分裂症, is it 精神分裂症? 精神分裂症 is actually schizophrenia. It's a different thing. It's a psychotic disorder. Or could it be 躁郁症? 躁郁症 is a bipolar mood disorder. So sometimes there are some similarities between these three, but we have to look at the overall. Then only we realize. Then only we can know which one is which, whether is the person is a DID 人格分裂症 or schizophrenia 精神分裂症 or bipolar mood disorder 躁郁症. Okay, but that one is another topic. That's another major topic already. So I'm not going to touch that today. So unless you have any other questions, then you can ask me later. All right. So our next question is how can past memories lead to depression or anxiety? So I will just go through four main themes that the usual themes that people have association or that is associated with the bad memories in the past. That means that I'm not lovable, I'm not good enough, I'm helpless and not in control, and I'm not safe. Okay, most of our memories sort of have some attachment to these beliefs, and sometimes there can be overlap between two beliefs or even three beliefs. You know, so for example, if a person who has been abandoned by one or two parents, okay, maybe a divorce, or it may not be a physical abandonment like a divorce, but it could be an emotional abandonment by father who maybe he was too busy at work at that time. Maybe sometimes there's some people in 1997 there was a financial crisis, so the fathers were all very busy with their work. They had to support the family. But when you were a child, maybe you were 8 years old, but when you were a child at that time, you may not be able to understand why daddy had to be away at work for so many days, and when he came back he was not emotionally in tune with you. He never really respond to you emotionally. When you just ask him anything, he say ha 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 like that only. Okay, but then he may not be so loving as you would have wanted him to be. So uh, this may actually you may actually grow up feeling I'm not loved. I'm not loved enough. You know. Another thing is the punitive upbringing is like punishment. For example, if you're being punished for everything or every little thing that you did in your childhood, then you feel that I'm not loved. You know, for example, yeah, then when and being punished, and sometimes the punitive upbringing may not just be being punished, but sometimes it could also mean an emotionally invalidated environment, an emotionally invalidated environment in the family. So what this means is that sometimes the family or the parents they do not validate your feelings. They do not validate your emotions. Maybe you tell them that you're angry, or you show that you're angry, and they say that yo, you cannot be angry, you cannot cry, you cannot talk back, so it's like you cannot voice your opinion. So I might as well just shut up and don't talk to you all. What I mean. So these kind of things can make you feel that I'm not lovable. So when you feel that you're not lovable, every little single trigger that triggers you, that you even now, let's say, okay, this abandoned by parents and punitive upbringing is like a cut on, let's say you have a wound. It's like a big cut. So even though your wound has so-called healed, but there's still a scar there, and every little trigger, the current later triggers, is like a touch on the scar, and you may feel that, oh, it's still painful. So what are the little triggers to this? For example, okay, I'm not lovable. For example, yeah, let's say your boyfriend or your husband forgot your birthday. So let's say you forgot your birthday, then you feel that I'm not lovable anymore. Then you get a catastrophic reaction. I'm not lovable. You don't love me anymore. And then what do you do? What is the next thing to do? The behavior. Or some women, they cut themselves. They cut themselves, or they do a self harm, bang their head on the wall, or they take overdose. So because they feel like it's a perceived abandonment, even though it's a small trigger. It's just a soft touch on the wound, but because the wound hurt so much, it was never really fully healed. So this thing forgot to buy you a birthday present or something. It may not be, maybe he was very busy at work or what, but maybe the next day he'll buy. But for you, it's so particular. I'm not loved anymore. You don't love me anymore. Okay, then your behavior, you may be self-harming yourself. And what do you do next? After your behavior, you may end up with some decision making which may be maladaptive. Some decision making which may be that, oh, and then you feel that, I think my boyfriend don't love me anymore, so I want to break off with him. So maybe the boyfriend actually is a good guy. Maybe he's a very good guy, but you just break up with him because of you perceive that he did not love you, or he abandoned you. All right. Okay. So let's go to the next one. I am not good enough. So, for example, this harsh criticism in the past makes you feel I'm not good enough. For example, somebody, okay, let's say a 8-year-old boy, he goes home from school. It's standard 2 lah. Goes home from school. Yeah, I got 90 marks for my mathematics. For my exam, 90 marks. 90 marks. So in his feeling is that he feel good lah. He feel happy. he feel happy that 90 marks I think quite good lah. I mean A plus, right? Then why the then the why if the response from the mother is, why didn't you get 100? Then he'll be thinking, he'll be a shock to him. Oh, why didn't I get 100? So 90 is not good enough. He is trained from young that 90 is not good enough. You know, like, oh, I must get 100 only is good enough, you see. So so he, when he believes like this, then every little thing that now the current triggers, let's say, yeah, I'm not good enough. So let's say the current trigger by maybe, for example, now currently, let's say he's working already, now adult already, 28 years old already. So maybe the boss just tells him, can you, your handwriting is not, oh, sorry. Maybe the boss just told him that maybe he's writing something, a dictation. Then the boss told him that, oh, you forgot the full stop there. So that could trigger a big anxiety for these kind of people, because of the boss just saying that you forgot a full stop there. It may seem very miscellaneous and very petty, but because he perceived that the boss is saying that I'm not good enough, so he may have a reaction, and he because of that, his behavior, he may throw out a fit at work, you know, and then his decision making, he may decide to, I just quit the job, I just don't want it, you know. So so this is also another issue. So for the 90 marks and the 100 marks, some patients who have this, they also have overlap with I'm not lovable, because I need to get 100 marks only I can please my mother, you know. So there's in a way is a approval seeking also. So I need to be so good, then my mother will love me. You know, I need to be so good. I need to be perfect. But how many of us can be perfect all the time? Most of us also, we never reach 100% in our life. We were only 70 or 60, 70, 80%. So most of the time, you'll be thinking that I'm a failure, because if I don't get 100, I'm a failure. This is actually a black or white thinking, all or none thinking. So if I'm either, it's like Hollywood or bust. I'm 100% perfect, or I'm a failure. So and coupled with that, I don't feel loved enough, because my mother didn't love me enough. With 90 marks, I'm not loved enough. Okay, so let's go to the next one. I'm helpless and not in control. Okay, for someone who had a memory when they were severely ill and hospitalized in the past. So when you are severely ill, how do you feel? Feel helpless, not in control. When you're poor and lack of sense of financial security in your life, you feel helpless, not in control. So that's why a lot of people also have, the current thing, the current COVID pandemic is actually it sweeps everybody. Everybody is affected, but it may affect some people even more. With those people who have had some past memories like this, it may affect some people even more than others. Like bullied in the past, helpless, not in control, unresolved grief over the death of a loved one may cause over concern of welfare of the current loved ones. So some people, they may feel guilty that they were not there, they did not come home in time to see the loved one on the deathbed. So this may cause a sense of helplessness, not being in control. So sometimes they may maybe the child is a bit sick, then they are over concerned. Oh no, just maybe okay, a bit, just running nose a bit. Oh, bring to emergency already. Oh, don't know what's a big problem, So they may be over concerned over the welfare of current ones. Sometimes some people, they may have had a memory of their own child crying because of an incident. Let's say the child was very severely ill and gave a high-pitched cry, all right, a high-pitched cry. And at that time, they needed to send the child to the emergency, to the ICU or that. And then after that, the child got well. But later on, whenever the child cry just a little bit, or maybe a whimper or a sob, they may have an overreaction also. They may think that, oh, my child is going to fall sick and all this kind of thing, and they may straight away bring to emergency as well. So, or they may actually react in a different way. Some may be very over concerned and distressed. Some may become over irritable. They may in the end up beating the child, you know, to stop the crying, because it's the crying is the trigger. The crying is the one that, wow, to that trigger your memory of the emergency. Okay, I'm not safe. So fear in relationships, after being sexually abused or molested in the past, history of being bullied, assaulted, or in a war zone may lead to PTSD. Past memories of being burgled can cause repetitive checking behavior. So, for example, um, uh, a girl who has been maybe sexually abused or molested in the past, she may grow up uh, not trusting men, and always also think, or also, and also she may believe that she's not safe. I'm not safe. So when she believes like that, every little trigger that happens can cause a big reaction. So, for example, let's say like she got married already, and then but because of the trauma, the past trauma, she in the bedroom with the husband, she may become frigid, you know, so she may not be able to because she just cannot, because it just reminded her of the past, you know, and then she may feel that she's not safe with the husband, she doesn't trust the husband. So what does she when she believes that when this kind of behavior, then it may create a lot of problems in the marital. There may be a lot of marital conflicts, and then she may even decide to divorce her husband, because she herself could not cope with with the with the paranoia, the distrust in men, and the sexuality. So that could end up with very drastic decision making. All right. So now, how past memories can lead to depression or anxiety? So let's say if we follow an adaptive information processing model, it explains how unhealed disturbing memories are stored in the brain and may result in dysfunctional adaptive information processing, which leads to maladaptive responses, sleep difficulties, lowered immune system, anxiety, depression, and lowered self-esteem. So maladaptive responses will most probably persist unless the associated unhealed memories are processed and healed. Okay, so this is not an egg, this is a brain, but a cartoon brain. Okay, but anyway, I'll just separate it into neocortex, the front one, and the hippocampus, the back one. Okay, so this neocortex is like our the part where, let's say, it's a smart part. So the semantic means meaning, and the hippocampus stores all your long-term memories. So it's episodic memory. Episodic means that you remember the memory by episodes. You remember exactly what happened, like that, like that, like that. Or what happened. Yeah. So let me go to the example. Sorry. Okay. So let's say you have let's say good or neutral memories. So good or neutral memories. Good or neutral memories it started in the episodic memory, but it will naturalize into a semantic memory. So I give you an example. For example, let's say you had a lovely dinner with your family when you were 8 years old, and maybe you had a very nice restaurant. The waiter opened the door very politely. You were served whatever steak or or fish or whatever, and the waiter was very polite. And then you can remember the tables, how were the tables like, and the who were there, the family members, exactly what drink you had. If you can remember exactly what happened that time, I would say that you were probably a genius. But because if you can remember every memory in such detail, I don't know anybody who can remember such detail in everything. But normally, when the good and neutral memories that we have, normally we just remember that, yeah, it was a happy memory. It was a happy memory at the ship or the Victoria Station or wherever, it was a happy memory. Yeah, I went there. But do you really remember all the details? Not really, because yes, already naturally naturalized into the semantic memory. Okay, so next we go to bad memories, many traumatic memories. So for it's different with the good memories, where the disturbing or traumatic memories, it's like stuck, it's like frozen. So when it's frozen there, then you remember every details. Like for example, if a girl was molested or sexually abused, they can remember exactly how the rapist or the burglar came into the house. They can remember exactly how his face looked like, how he sneer, how his where his hands were, and all that kind of thing. They can remember exactly. So the episodic memory become very entrenched, very very uh, it's like clear. It's like very clear to you. It's sometimes you can even remember exactly like what happened, like a flashback. It's like a repeated video. You can still remember it like yesterday. You know. So this is actually the trigger, the current trigger now. Like say like this, the one inside the brain is the past memory, but the one outside is the current trigger. So for example, let's say the girl who was traumatized by the sexual assault, then this one the current trigger, maybe the boyfriend just want to hold her hand. Oh, she may have a catastrophic reaction. She may just pull out and then slap him, and then she will not realize why she did that. Because this is actually like rubbing, not rubbing salt on old wounds, but touching the wound, the touching the unhealed wound. It's not a cut anymore, but it's just a touch, but the touch also feels like a cut, if you get what I mean. All right. So you can still affect that. And you have an emotional memory and a body memory. So you can also exactly the whole emotional memory, and you can also feel uh, you can also have the body sensations. That is what we call the 身体记忆, the body memory of exactly how you felt at that time. So some people, their common anxiety symptom is they may have a lump in the throat. For example, some patient maybe when they're anxious, the first anxiety probably happened, and then she had a lump in the throat. So all the connected triggers, the connected current memories, she will have a lump in the throat. So that lump in the throat actually is a body memory. So for example, there's one patient, who was referred. It was a conversion disorder. Doctors will know that, but had a traumatic memory. Her body memory, or her conversion symptom was actually she can't walk. Her whole lower limbs, legs, she couldn't get up from the wheelchair. But after we went back and healed the unhealed memories, she slowly get could stand up, from the wheelchair. So this is how amazing it is that once you heal the unhealed memories, even the body memories can go away. Okay. So next we go to, if let's say once we do the healing, and it will just be like the neutral memory, just naturalize into the semantic memory, and then the emotional memory and the body memory will disappear. Even though there's a trigger, but it doesn't affect you so much anymore. So, well, what can we do with the past memories and how can therapy help? Access, we will help you focus to the event while we facilitate your self-healing. We loosen the process is to loosen the disturbing frozen memory and activate and stimulate your unconscious self-healing mechanisms. And then we help you resolve to assimilate the adaptive information. So it's like this. If you can you imagine a spider web on your left? This is like a network of memories. Okay, for example, maybe all the network of the bad memories is intertwined. All the I'm not lovable, I'm not good enough. Maybe since I got certain memories have I'm not lovable, I'm not intertwined, and I'm helpless, I'm not safe also, you know. So it may have intertwined, and then there may be a lot of other branches. So this is like a complex thing. So when we do therapy, it's like we poke a bit, you know. We settle one memory, we poke, and then we loosen the spider cobweb, and we loosen a bit more. We loosen a bit more, so it doesn't become so complex and so complicated and so dense, you know. Slowly we poke, desensitize, poke, and then slowly we loosen it, and then hopefully one day the whole cobweb will be gone. All right. Okay. So when to consider medications and when to consider psychotherapy? This is actually quite a common question a lot of people want to ask me. So, for example, just look at this tree, and then the branches are all the depressive symptoms, all the depressed mood, loss of appetite, lethargy, all that, and all the anxiety symptoms. These kind of things at the branches, medication can help, okay, but so medication can help. So, for example, when you go to a dentist, imagine you're going for a dentist, and then the dentist want to extract your tooth. So sometimes certain tools are too difficult to extract, or the root canal is too deep. You need some painkillers and something to numb it, the gums, to not to feel so much pain. Or sometimes you can just take it out straight away. So sometimes medications can help in that way, but the most important thing is to get to the root of the problem. Okay, and how to get to the root of the problem is by settling the memories of the past, which has associations with the I'm not lovable, I'm not good enough, I'm helpless and not in control, and I'm not safe, and there are many others, but these are the common ones. So, can I do psychotherapy without medications? Okay, let's just imagine. Can I do psychotherapy without medication? Look at this tree. If this tree, the foliage, the branches is so dense, is so complicated, so that means the symptoms of the depressive and anxiety is all over the place. Sometimes you may need to stabilize it a bit. Sometimes you may need to cut the branches and the leaves first. Then only you can take out the roots. That means you may need to use medications first before you can go to it. You need to stabilize your medications first before you can go to the roots. Because let's say if you go to the roots straight away and try to chop off this tree from the roots, what will happen? I think this whole tree will collapse on you, and all the branches will collapse on you. You know. So, but sometimes we have to see if it's too severe, the symptoms too complicated. Sometimes we need medications. All right. Um, But let's say after we cut all the branches and the trees already, or and it becomes like this, on the right side here, the white color ones, you know. So let's say now, okay, now it's safe to take it out from the roots because the tree is not going to fall on you. All right. Or let's say if you come at this situation, you're just moderate, and we can still try attempt psychotherapy, you know, without medication. Of course, the best is when it's just a shoot here. This one we can just nip it in the bud. This is so much easier. So like I said in the very beginning, from my very first slide, I said that don't wait until there's an impairment, you know. Don't wait until the bridge collapses. This is like when you nip it in the bud, it's like when you see some little cracks in your bridge, you can cement first. You can seek help first. So don't it is actually we can use psychotherapy alone, but sometimes we may need to use psychotherapy and medications. And some people they are just happy with medications. They just want to cut off the all the branches and leaves, and that's it. They're happy. I don't need to take off the roots. Some people are like that. Some people they're not interested in that. So it takes all kinds to make the world. There are some people who just need psychotherapy. They don't need medications. Some people they need psychotherapy and medication. Some people they just want medications. But most importantly, if you are feeling there are certain cracks in your bridge already, then then it will be wise of you to come seek for a consultation and assessment, and let us assess and see, whether whether you need psychotherapy only or psychotherapy plus medications. Well, of course, go for the therapists who know go for the psychiatrists who know how to do therapy lah, and is certified to do the therapy lah. Okay. So if I'm depressed, does it mean that I'm mentally weak? Depression is not a sign of weakness. It means that you have been strong for far too long. So if you can imagine a tong sampah, if you are a tong sampah, if you're a dustbin, okay, but some dustbin made of straw, some dustbin made of plastic, some dustbin made of metal. But even though you're made of metal, the strong dustbin also, when there's too much sampah inside, too much rubbish inside, it will still overflow and you'll still become dirty. So sometimes when you sense that there's getting a bit overcrowded with rubbish, you need to seek help. Take it out little bit, because try not to stay strong for far too long. Depression is not a weakness. Okay, so but we are here to help you whenever you need to. That's all. Thank you. Okay. So I have some questions here. Oh, I have some questions here from someone. Okay. She asked me, I have same dream on and off, and of looking for things and walking up staircases. And inside the dream, I feel scared and anxious. Is this related to my past memories and fear? And how can I get rid of these kind of dreams? Okay, for this is quite a interesting thing. Probably you need to come and see me for consultation. But but anyway, okay, it's quite difficult to just normally for dream analysis also we need about an hour session, to fully analyze your dreams and all that. So, but first let me go step by step. Okay, dreams according to Sigmund Freud, are the royal roads to your unconscious mind. Okay, so dreams are actually your own fears and anxiety in the current life, in the current situation. But it may also be a flashback from your past. It may also be due to nightmares from a past trauma. That could also be. Okay, so let me get to the function of a dream first. Okay, the dream function is to help you sleep. You want to sleep. Okay, so let me go even more basic. Dreams, sleep, there are 5 stages. Okay, there's stage 1, stage 2, stage 3, stage 4, and the REM sleep. REM sleep is the rapid eye movement sleep. Okay, so for the stage 1, stage 2 sleep is light sleep, is the light sleep, and you can still be awakened. Then the deep sleep is stage 3, stage 4. You can have dreams in stage 3, stage 4 also, but usually the dreams in stage 3, stage 4 you don't really remember. Is actually it's kind of static dreams. It doesn't move so much. The ones that you remember and the dreams that look like video clip like yours, walking out downstairs, it doesn't usually happen in the REM sleep. There's the rapid eye movement sleep. So that's why when we wake up, usually we wake up after the REM sleep. Then we will remember our dreams. The dream that we remember normally is in the REM sleep. Okay, enough about the boring stuff. Okay, so now we go to what is the dream function? The dream function is actually to help you continue your sleep. So let's say if the dream awakens you in the middle of the night, like a nightmare or what, actually it's called a failed dream. It's a failed dream, So the dream did not serve its function. So I do not know whether you woke up from this dream or not. Okay, but anyway, okay, regarding your question, is this related to my past memories and fear? That is possible if you have had a traumatic memory. But the thing is that you may also have concurrent triggers or precipitants currently, which may be affecting how you are dreaming. And the dream here, I don't know when your same dream on and off, is it like since how old lah? Okay, because this one is not very clear. You didn't say how old you had the same dream on and off. So this one I need to understand more, and I need to understand more about your background, your family background, your personality, and all that before I can really give a clear diagnosis or whatever your dream is about lah. But anyway, if you're looking for things walking up staircases, okay, we need to understand what does a staircase mean to you. What does a staircase mean to you? Is it something, for example, some people, for example, if a person who has fallen down the staircase before, so staircase could mean something fearful. Maybe some people they feel that staircases are a highway to heaven, or it could be different meaning to different people. So you're looking for something. So how was your feeling when you were looking for that thing? Were you feeling anxious? Were you feeling lost? Were you feeling restless? What was your feeling at that time? So sometimes it may relate to your current situation. Maybe are you looking for something now? Are you ambiguous? But this is um, I can't really totally answer your question because I need to have more information about your dream, not only your dream, but about yourself and your whole personality and also family background and all that to fully understand your family dynamics. Then only we can interpret your dream. If that is so, I don't want to jump to conclusions so much, but because uh, um, probably you need more analysis on that dream. Okay. So what is my next? There are a few questions about dreams as well. So, the dreams, I would say that it's difficult to do dream analysis online, and when I do not have that much information about yourself. So, like I said just now, uh, there is another question about dreams. Is that I have often dream about several places since young. I'm clearly aware that I am in my dream and I know what sorts of things I will see as I walk around the building. However, all these places that I used to do not exist in the real world. I would be grateful if Dr. Kelvin Lee could help in revealing the meaning behind of my dream. Thank you so much. Okay, so like I said just now, I think probably this one I need more background information about you because it's best not to jump to conclusion because dreams are very subjective and there's a lot of unconscious process. I truly need to understand your whole personality and background before I can help you interpret your dream. Okay. Uh, how do you heal the unhealthy body memory? This one I think I have already covered that in my talk. Okay. 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 So there's another person who asked me, husband had an accident about 10 years ago and the family was under extreme stress with no help and suddenly realized that the family and friends are not really there for you when you needed them. It became phobia ever since then with even if he's tired or unwell. How could we overcome this? So like you said, this has been a traumatic experience for you. Your husband had an accident 10 years ago, all right? And at that time, nobody came to help. So this was actually a very traumatic experience to you. Probably at that time, I'm just making a guess. that maybe you felt helpless, and not really in control. So that's why you become phobic. Now, even when little things like he's a bit tired or a little bit unwell, you become very phobia already. Means that you are this reaction is actually uh of too much already. I mean, it's like reenacting exactly what happened that time. So you're actually very afraid of oh, he tired or unwell a bit. Oh, then the helplessness come back, your thought of, oh, I'm helpless, maybe no one will come and help us again, what do I do now? So this is actually due to your this thing. I think probably you need to come and do therapy, because we this thing we can help with that. If we can settle that memory, heal that memory, the 10 years ago accident, with no help you gain your self-healing from the helplessness, then I don't think you that easily triggered. Like I said, the 10 years ago memory, when your husband had accident, nobody came to help you and you were helpless. This was a big cut. And then now, even when he's tired or unwell a bit, your memory did not heal properly. So when there's a touch, now you feel, oh, so overwhelmed. I have phobia already. So definitely we need to settle that memory. Okay. Okay. Another question asked me, Dr. Kelvin, why many symptoms of depression will occur after therapy? And also, while the therapy going on, I need to change my medicine. Okay, this is a very important, significant, significant question. Why many symptoms of depression will occur after psychotherapy? Okay, one thing I need to ask you is that, is it a completed memory? Is it a completed therapy at that time? If it was halfway done, then it could. Okay, for example, okay, I let you imagine, when we do psychotherapy, it's like doing, let's say, for example, let's say you're doing surgery to remove a tumor. For example, let's say we imagine we're doing mind surgery for a tumor. All right. So now, when we start the psychotherapy, I cut, I cut, and then I slowly open up, and then I want to take out the tumor. And then, for example, if let's say while the cutting I haven't taken out the tumor, or I just taking out half of it, and let's say if you stop therapy halfway, and you did not completely finish it, then is the tumor still there? The tumor is still there. I have not finished my surgery. So you have to completely finish the therapy. For example, even if I take off the tumor already, but I have not closed, I have not sutured up. So it's not a completed therapy yet. So when it's not a completed therapy, means that it's not totally healed yet. You will still, that's why you're feeling the depression and the pain, because maybe the tumor is taken out, but I have not closed up, I have not sutured up, I have, oh, bo kam ki lai go kali wound, So that could be the reason why you are still having depressive symptoms after psychotherapy. And another reason is that, like I said just now, that in the psychotherapy, there's a spider web. So I loosen a bit. Can I go to the spider web? Okay. Oh, okay. For example, even if we completed one memory, let's say for example, I completed one memory, but maybe if let's say it's a very complicated emotion, there may be certain attached memories to it which we need to deal with as well. Then you will feel better. Then the depression symptoms will go away. So uh, it's not first thing is we need to first thing is that you have to complete the whole memory first before we can say anything. And then another thing is that one memory may be also attached to another blocking memory, another blocking memory, another blocking memory. So there may be intertwined certain memories different memories that we need to settle all together as well. So sometimes that's why sometimes some people feel that oh, after therapy I feel worse. But like I always tell my patient, therapy sometimes is like surgery, a mind surgery, a psycho, psychotherapy is a mind surgery. So when we want to, if you leave halfway in the therapy while I'm cutting, while I'm taking out the tumor, while I take out the tumor but I haven't closed yet, then it can cause more pain. Yeah. So that's why sometimes you need medications to help stabilize. And then sometimes you may need the change of medications to help stabilize as well. Because like I said, for example, if you look at the chuchang here, the tree here, uh, the sometimes it could be like this. So that's why you may need change of medications to make a bigger saw, to cut a bigger branch, to help it uh, to help the tree become not so dense, then it's easier to take out the root. All right. Okay. Good afternoon, doctor. Is another question. Good afternoon, doctor. Is it normal to have vivid dreams every single night? And up to what stage that I need to seek medical attention and it is affecting my energy the day after? Then I think that this is already a sign that there's a crack in your bridge, that you probably will need to seek uh, medical advice already, because vivid dreams every night. I mean, this one could be uh, something traumatic happening easily, but he didn't say vivid dreams since when lah. It's like every night, saying every single night. Is it since childhood? Is it since recently? So we have to understand since when. And but if it's vivid dreams every single night, it looks like it's quite serious, and it's affecting your energy the day after. I think it's quite serious. I think probably you need to seek a medical uh, advice or attention as soon as possible. Okay. Why I will feel uncomfortable after doing this? I already answered that question. Okay. How will a teenager fall into depression and anxiety? Will puberty affect this? Okay. There are a lot of factors, like I said, the bio, psycho, social, spiritual. There are a lot of factors how a teenager can fall into depression and anxiety. Uh, when you go through puberty, there are a lot of hormonal changes. When the teenager, there's a lot of change, like becoming from a child to an adult. You're uh, you're starting to have a lot of exams. You're starting to fall in love. You may get rejected. And you have peer groups. You want to join this peer group, but then you don't get approved. So there are a lot of loopholes that could affect a teenager lah. So it's like being a teenager is not easy. So uh, there are a lot of factors why a teenager can fall into depression and anxiety. So, but I would say that the puberty alone is not the only cause. I think there are other more significant causes. Mhm. Yeah, and then another person asked me, Dr. Kelvin, do you do psychotherapy? Yes, I do psychotherapy. Uh, yes, I do psychotherapy. I think probably maybe you may have missed my first slide here. Maybe you missed my beginning of my presentation. Uh, I have intensive training and I'm certified in the EMDR, clinical hypnotherapy, CBT, and also sample therapy. So I do psychotherapy. Okay. 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 I think that's all. Thank you very much.